Okay, so data breaches. Yeah, we hear about them all the time, right?
Yeah.
But this one's different. This one hits different. We're talking way beyond stolen credit card numbers, folks.
This is about, well, it's about the kind of information you never think you'd have to worry about.
Exactly. It's unsettling, really. We're diving into a piece from the Washington Post, and it's about Lehigh Valley Health Network. They're on the hook for a $65 million settlement. You want to know why? Hackers.
And not just your run-of-the-mill hackers, what they got their hands on.
It's bad. We're talking nude photos of patients, photos taken during radiation treatment, leaked online.
It's really hard to imagine the violation, the feeling of, I don't know, betrayal even, that these patients must be going through. Think about it, you're undergoing cancer treatment,
Yeah.
you're at your most vulnerable, and you're trusting these people with your care, with your life, really. Then to find out that these images you probably didn't even know existed, are out there for the world to see.
The Post actually focuses on one woman, they call her Jane Doe, and she had no clue these photos even existed. Then she gets a call from the network offering apologies and 2 years of credit monitoring.
Can you imagine? I mean, the article, it says she was in complete disbelief. I mean, wouldn't you be? This isn't just some data point being sold. It's deeply personal.
It really makes you think twice about just how secure, how private our healthcare data really is. I mean, we hear about breaches all the time, but this feels different. This feels like a punch to the gut.
And it should. Because healthcare, these institutions, they're becoming prime targets. Why? Think about it. They're sitting on a gold mine of information. Social security numbers, medical histories, financial data. It's all incredibly valuable.
So it's not just about the money they can make by stealing this data, it's the damage they can cause with it, right?
Exactly. And here's the scary part. A lot of these healthcare systems, they're playing catch up when it comes to security. Their systems are complicated, multiple points of access, they're under pressure to adopt new technologies.
Yeah.
It creates vulnerabilities.
So it's almost like a hospital with 1,000 unlocked doors.
In a way, yeah. And the attacks, they're becoming more and more frequent. In fact, the FBI, they said that in 2023, healthcare actually topped the list for ransomware complaints, more than any other sector.
See, that's what I mean. That's chilling. We rely on these places, on these systems for our well-being.
And it's not just about the data. It's about the human cost,
Yeah.
the trust that's broken, the feeling of violation. How do you even measure that? And then you have to think about the long-term consequences. What happens when people are afraid to even go to the doctor?
Or when they don't feel like they can be totally honest because they're worried about their privacy.
I mean, it really makes you wonder, doesn't it? What if people start avoiding going to the doctor altogether, putting off important treatments because they're too afraid of their information getting out there?
It's scary to think about. We're talking about a potential breakdown of trust in the whole system. And it's not just small clinics that are vulnerable, right? I mean, in this article, it mentioned Change Healthcare, that's part of United Health Group, and they got hit with a huge attack.
Yeah, that one was big. ALPHV, the ransomware group, they were behind that one. The article said that a substantial proportion of Americans had their data compromised.
Substantial proportion of Americans. Kind of chilling when you really think about how many people that could be. And it brings up a tough question. What are these organizations supposed to do when hackers demand a ransom? Lehigh Valley, they refuse to pay, which I get it, but
It's a rock in a hard place, right?
yeah.
Pay up, and you might be encouraging more attacks. But if you don't, and the hackers release the information, well, we saw what happened with those photos. Those patients, they're the ones who really suffer.
The article, it pointed out that United Health Group, they did end up paying ALPHV $22 million. So you have one organization refusing to pay and another one shelling out millions. How do you even begin to make that decision?
There are no easy answers, that's for sure. It highlights the fact that there's no magic bullet when it comes to cybersecurity. You need a whole system, and it has to constantly be evolving. Security protocols, employee training, you name it.
Yeah.
And even then, well, we've seen that it's not always enough.
So where does that leave us, the patients? What can we really do to protect ourselves in this digital world? It can feel kind of hopeless, like we're just supposed to accept that our information is out there. I mean, it feels like, I don't know, like we're supposed to just hand over all this personal information, but no one tells you how to protect yourself, you know?
Yeah, it's tricky. There's not one single thing you can do to, like, completely eliminate the risk, but there are ways to be smarter about it, be more aware.
Okay, so what can we actually do? Give us the tips.
Well, it starts with, I guess, just being mindful. Like, think about the information you're giving out, even at just a regular doctor's appointment. Do they really need your social security number? Or is there another way to, confirm who you are.
Yeah, you're right. We just hand that over without even thinking about it half the time.
Exactly. And phishing scams, those are a big one. Be careful. They're getting really good at making them look like they're from a real doctor's office or insurance company.
Oh, tell me about it. I've almost fallen for a few myself. They look so real.
Right. So double check the email address. Don't just click links without looking. And something feels off, just trust your gut. And honestly, stay informed. Data breaches, they're not going anywhere, unfortunately. So keep an eye on your accounts. Check for any weird activity. And if you think your information has been compromised, know what to do.
Yeah, information is power, right? The more you know about the risks and what you can do, the better.
100%. And I think bigger picture, we got to keep talking about this whole thing. Innovation in healthcare is great, but not if it means our privacy goes out the window.
It's a tough balance, right? We want the benefits of all this new technology, telehealth, AI, all that, but it shouldn't mean giving up our right to privacy.
Exactly. This case, it really makes you ask, how much are we willing to risk? How much privacy just for, I don't know, the convenience of digital healthcare? And how do we make sure that our information is protected, that it's not just an afterthought?
It's a conversation we all need to be a part of. Patients, doctors, even the tech companies themselves. We have to demand better, make sure our data is secure.
Absolutely.
Yeah.
It's about creating a future where innovation and privacy, they work together, not against each other. And that takes all of us.
This has been, well, it's been eye-opening, that's for sure. It's a little unsettling, but it's so important to be aware of all this.
It really makes you think. Technology is changing healthcare in huge ways, and we have to make sure those changes don't come at the cost of our privacy.
Couldn't have said it better myself. This case, as tough as it is to hear about, it reminds us that we have to pay attention. We have to be careful with our information, especially when it comes to our health. And it's not just about protecting ourselves. It's about demanding better from the system, making sure they're doing everything they can to keep our data safe. It's a challenge, no doubt, but it's one we have to face head on if we want a digital future that's actually working for us.